So I wanted to address another question of how often should I get adjusted? So there's a few things to start with before I can really answer that, and unfortunately that's not going to be the exact same answer for everyone. So the typical medical answer of it depends. So first off, if this is an acute injury or a recent injury, usually we'll do some more adjustments to get things started, get things moving quickly, get you out of pain, go from there. Versus like a chronic scenario or something that's lasted for a few months or years, whatever the case may be, would take a lot longer. So that treatment may start a little bit, quite like a little more frequent up front, but then it's going to be spread out, and over the course of the whole situation, it's definitely going to take a lot longer to get better. The longer you've had it, usually the longer it takes to get better. And then going into as things finish, of maintenance and long-term care, what do I recommend? So the next question would be, what are your goals? Are you intending to I want to just get out of pain and then I'm good, and then I'll see you again when it shows back up? Or are you in that position that you're tired of this happening over and over again, or you just want to stay healthy, move better? I have patients that come in every 2 weeks. I have patients that come in every 6 to 8 weeks. So somewhere between that 2 weeks, 2 months range seems to be a pretty good sweet spot, and everyone's a little bit different on what they find to be most effective for them. And the research does support that maintenance care is definitely better than just stopping care and starting as things come back. So what they have found is that people who are on a maintenance plan of any sort, usually they do the research at that 2 weeks, every 2 weeks. But if you're coming in on a regular basis, they've shown that people have a tendency of having less intense flare-ups, so that pain's coming back and it's not as bad as before, and those flare-ups are happening less often. So some of these, like, every 6 months this pain comes back, that's going further and further without those flare-ups. And there's a lot of reasons why that could be, and one of them I would say that's really common is the fact that if you're coming in on a regular basis, you're coming in sooner than that person who is just showing up when I can't handle this back pain, it's been nagging at me for a month now I'll show up and see what happens. It's going to take a lot more work to be able to get out of that pain, and so it's going to take more effort to get you there. So like I said, there's a few factors, and it depends on how old you are, your health history, how many times you've had this happen, the severity of the problem. So there's a lot of factors, unfortunately, and that's kind of why that gap is so big on how often treatment is recommended. So it solely depends on the individual and what's going on. The reason, again, that this is important is you think of just generalized movement is a good option, is a good idea. We should move, we should do activities, whatever the case may be, to keep ourselves moving. And if we stop moving, things get worse. And then going kind of the next step down would be more of that. That would be more of a generalized movement. More of a specific movement would be things like yoga or workouts, Pilates, something that's going to focus on certain areas, which, again, another level of just trying to get you to move better. And then the layer that we're working on with chiropractic treatment is going to be more of that segmental motion. So that would be the joints in the neck, the back, the knees, wherever. The joints that we're working on is we're trying to get that specific joint to move better, so then that will help that regional or specific motion, and then generalized motion. So they all kind of feed on each other. But if you're not moving well at that segmental level, the generalized motion is not as good. And if you're not moving in that general, it will start affecting the others. So keep yourself moving. I'm here to help. Getting adjusted definitely can make things easier to get you move better faster, and it helps to maintain a good healthy body, so then you can keep moving and keep yourself healthy. Hopefully that helps. I'm Dr. Darren Howarth with Summit to Shore Chiropractic, and thanks for watching. We'll see you next time.